nearing menopause. Just kidding. If you're a woman nearing menopause or in menopause and you've wondered about hormone replacement therapy, today is your lucky day. Here to tell us all we need to know about HRT for women is the author of Unlock Your Menopause Type, Dr. Heather Hirsch. Welcome back to the show. Thank you. So, for those who don't know, what is HRT?
So it's so important that as women, we learn that we lose our female hormones as we go through the perimenopause to menopause transition. So hormone therapy is a way for us to replace those hormones that we've had all of our lives that all of a sudden we lose.
Yeah. I think that our generation, my generation, we were sort of taught that that was dangerous.
It wasn't safe.
It wasn't safe.
It was safe.
It is so safe. We now have so much data to support how safe hormone therapy is. And as we lose those hormones, it would be, make sense to replace some of those hormones as we go through this transition.
Okay, so how do we start, where to start, and why start?
So I think it is so important for women to know if they are suffering with symptoms, they should absolutely consider hormone therapy. So particularly for hot flashes, night sweats, vaginal dryness, but we also know that it can improve mood, irritability, joint aches and pains, insomnia, and even things like hair loss, brittle nails.
You almost fainted at vaginal dryness.
I've never had hormone replacement therapy, but it's changed my life.
Relationships, right?
Yeah.
So by treating my female patients, I'm also treating their families too.
Yes.
It's true. So in addition to relieving symptoms, what are the other benefits? There's a lot of health benefits.
Yes. So this might surprise a lot of people, but we know that if you start hormone therapy, within 10 years for menopause, women live longer, die less from all causes, and have less heart disease, less diabetes, they work longer, they feel more productive, and even have better bone health.
Okay, age to start, age to stop the use of, and can you start before you have the symptoms?
So there's no time at which it's the best time to start. So I truly believe it's when you start having symptoms. So this could even be in perimenopause when women are still having cycles, or menopause. And we also know there is no time limit at which you must stop hormone therapy.
Okay.
I think you do the hormone therapy as long as you want to feel good.
Right, exactly.
That's my belief.
Right.
Personally.
It's really an individualized discussion that you have with your clinician, but if it is still helping, it's still safe for you, and it's treating all of your needs, it is really safe to keep you safe.
Is there an age that's too late to start?
So we know the benefits really kick in if you start within 10 years from menopause, which is why it's so important to talk about it. But even for women who are out of that 10-year window, they still should consult with a doctor.
Is there anyone at risk or anyone who this is not recommended for?
So every single case, in my opinion, is absolutely individualized. However, we should proceed with caution if women have end-stage liver disease, a history of a blood clot or a lung clot, or active breast cancer.
Okay, we have to take a commercial break, but we've got more information about hormone replacement therapy, plus the over-the-counter options when we return. Stick around.